Hello everyone, my name is Zinab Dokadir, but everyone calls me Z. Today I will be going over my vendor evaluation matrix for Dr. Rutledge course, Project Management in Health Information 655 at Mercer University. So for this group assignment, we were given a task to be a project manager and have a project team in which we review and analyze different vendors that are available for electronic clinical documentation system. And as we review the different vendors, we will have to choose as a team which vendor to implement within the given organization. So the first step I took was opening the vendor evaluation matrix template and reviewing all the functionality and usability questions. After reviewing those, I tried to prioritize on each section, and there was actually 8 sections. It was charting, prescriptions, lab and result management, decision support, disease and population management, health record management, clinical tasking, and messaging, and financial consideration. And within those 8 tasks, I tried to prioritize what was the most important to the least important numerically, with 1 being the most important and I think 9 being the least. After looking at this template, me and my other team members chose our 3 vendors for this assignment, and we communicated in various ways. We had 2 WebEx meetings. We communicated through text messages and also emails. So when we were choosing our 3 vendors at the beginning of this assignment, we went with Allscript, NextGen, and McKesson. We chose those 3 vendors, but however, we had to make some modifications as we went further into research. A fellow group member found that McKesson was bought out by Allscript, so there was minimal information and data available for us to use on this assignment. So we ended up agreeing to switch over McKesson for eClinicalWorks. So after completing that part of the assignment, everyone went and did their portion of looking through the 3 vendors, eClinical, NextGen, and Allscript, and prioritizing what is most important to them and rating each section from being a numerical order of 1 being poor or 5 being excellent. So after we completed that part, we came together and had our final WebEx meeting as a team, and we came up with a consensus on which vendor or product we will choose as a team. So when choosing this, when I first came into the group, I wanted to go with eClinical, and I've had another classmate or another team member of mine agree with me. When I went and did research on eClinical, everything just sounded amazing. They had a lot of functionality. They had accessibility, providers being able to manage and review tasks from remote locations using their mobile devices, their iPads, their computers at home. So I just thought this was the best clinical documentation system that I've ever seen. But as a group, we had a discussion and we gave everyone the opportunity to basically defend why they feel the vendor that they chose was the best. And at the end, we tallied which vendor had the most agreements amongst the group. So we first automatically agreed that NextGen wasn't for us as a team. We found that its functionalities wasn't as accessible and it wasn't user friendly. So it was between Allscripts and eClinical. So we ended up decided going with Allscript after speaking with everyone and hearing their sides and what information they found during their research. We came up to a conclusion that we will be choosing Allscript as our product. So overall, This project was extensive. I feel as a project manager, you had to be able to thoroughly communicate with each member and be able to see everyone's views of the different products, and also seeing everyone's views on what they felt was best. But when we came to a conclusion, I agree that Allscript did have some really good, basically really good functions made for the end users. So thank you so much.